Okay, we're about to broadcast, so Terry, and you're ready to go in about 5 seconds, is that all right?
Good morning, I'm Terry Lake, CEO of the BC Care Providers Association and Engage BC. Welcome and thank you for attending today's special Care to Chat on the BC election. Before we start, I'd like to acknowledge that we are hosting this meeting on the traditional lands of the Coast Salish people and to extend our appreciation for the opportunity to hold this dialogue here today. I'd also like to thank Bob Breen, Executive Director of the Denominational Health Association, for co-hosting this event. I'd also like to express our gratitude to Rexall Health Solutions, our title sponsor for Care to Chat 2020-2021 season. And thank you to our gold sponsor, Point Click Care, and our silver sponsors, Sobeys National Pharmacy Group and Medical Pharmacies. Without your support, events like this would not be possible. And this is a very important opportunity for us with our Care to Chat series. And now I'd like to introduce Ganas Moodley. He's the Director of Customer Success for Rexall Health Solutions. Ganas has over 20 years of pharmacy experience, which includes extensive, I should say. I don't know if it's that expensive, but it's extensive. Experience including the experience in the regional pharmacy operations in Ontario and BC, both in retail, also in public hospitals, private hospitals, clinic pharmacy, and long-term care pharmacy practice. He's dedicated the last 15 years of his career to long-term care pharmacy. He's recently assumed the role of Director of Customer Services, and those who have had the pleasure of working with Ganas know that he's a pharmacist with a strong customer service focus and a commitment to resident care. So I'm going to turn off our staff cameras now and turn it over to Ganas to say a few words, and then we'll go over to our Master of Ceremonies, our moderator, Mike Klassen. Thanks for being with us here today.
Thank you, Terry, and good morning, everybody. In my recent role as the district manager for Western Canada, I had the responsibility of overseeing pharmacy operations both in BC and Alberta, caring for thousands of seniors. This pandemic has taught us many things, and how to move forward caring for our seniors is no exception. At Rexall Health Solutions, we have always had stringent quality control procedures in our pharmacies. But as we move through this pandemic, like everyone, we had to adapt in order to ensure proper services seamlessly. As we move forward with the learnings from the past months, we welcome the opportunity to be part of the change that protects and enhances care for our seniors. It is now my pleasure to introduce today's panelists. First panelist for us today is Adrian Dix, BC NDP candidate, Vancouver-Kingsway. Adrian was first elected as the MLA for the Vancouver-Kingsway in 2005 and re-elected in 2009, 2013, and 2017. He lives in Collingwood, and his work has always been inspired by the place and people of Vancouver-Kingsway. Over the last 15 years, Adrian has stood shoulder to shoulder with the community to save neighborhood schools for closure, expand the Collingwood Neighborhood House, create the New Rise Community Health Center on Joyce Street, and rebuild the Sunny Hill Health Center for Children, and improve safety at the SkyTrain stations. Amid a global pandemic, Adrian has risen to the duty of leading the province's COVID-19 response as the Minister of Health. The next panelist is Annemieke Holthuis, BC Green candidate, Victoria-Swan Lake. Annemieke's passion for justice, human rights, and democracy started early and led her to become a human rights and an international lawyer. For the last 30 years, she's worked as a legal advisor to the Government of Canada on human rights issues and criminal law reform. She represented Canada internationally, negotiating treaties and participating in Commonwealth and G7 meetings. Annemieke believes we should focus on what connects us rather than the things that divide us. Norm Letnick, BC Liberal candidate, Kelowna-Lake Country. Norm was re-elected to a third term as the MLA for Kelowna-Lake Country on May 9, 2017. He is the official opposition health critic, served for 4 years as BC Minister of Agriculture, Norm has been married to Alina for 38 years. They have 3 adult children living in Kelowna and 2 grandchildren. Prior to his election as an MLA in 2009, Norm sat on the municipal council in both Kelowna 2005 to 2008 and Banff 1992 to 1998, and was the 10-year associate professor in Okanagan University College's business program. His business experience comes from having owned several financial services and technology-related small businesses. Norm holds a Bachelor of Commerce degree with the Rhodes Scholarship nominated from the University of Calgary, a Master of Business Administration from Edinburgh, Heriot-Watt University, and achieved status for PhD in Health Economics from the University of British Columbia. Norm writes monthly columns for the Kelowna Daily Courier on health matters. And finally, our moderator for today's debate is Mike Klassen, VP of Public Affairs, BC CPA. I hand it over to Mike.
Thank you, Ganas, and good morning to everyone. And thank you for attending this important dialogue on seniors care and seniors issues in British Columbia. In just 8 days, British Columbians will have their last opportunity to vote for those they would like to represent them as members of the legislature for the next 4 years. But these are not ordinary times, and this is no ordinary election, thanks to the global pandemic. Furthermore, those who are most directly impacted by the spread of the virus are our seniors, their family members, and the people whose job it is to bring comfort and care to BC's older adults. It has been widely acknowledged that BC has done a better job than many jurisdictions when it comes to fighting the COVID threat, especially in our seniors' care homes. That success is partly the result of a collaborative Team BC approach among public health, the BC Health Ministry and the Minister himself, members of the opposition and our health authorities, providers of long-term care, assisted living, independent living, and home health. As well, BC Care Providers Association played a role along with Denominational Health and BC Seniors Living Association. The format is straightforward for today's town hall. After a short introductory statement by the candidate, each will be asked the same question by me and be given 2 minutes to respond. Our time is limited, so please do not take offense if I choose to interrupt anyone mid-sentence, which I'll do my best to avoid. The questions were developed in consultation with our associations and many of our members, and from the feedback we have been receiving throughout the pandemic. Regarding the speaking order, we'll begin by asking candidates in alphabetical order, then a different candidate will be given the opportunity each time to answer the question first. We encourage those of you with Twitter accounts to tweet about what you're hearing today using the #CareChat hashtag. And my aim is, of course, to try and have everybody concluded and out of here by 12:15. So with that, I'll begin by inviting Adrian Dix, BC NDP candidate for Vancouver-Kingsway, to open. Adrian.
Hey, thank you, Mike, and good morning to Norm and good morning to Annemieke. I wanted to first of all start by expressing my thanks, my gratitude to the people on the call. The Canadian Medical Association Journal recently released a comparison between BC and Ontario, and it says very much what I just said, Mike, that we had done better in BC. Not perfect, and there has been a lot of suffering and grief, but better in BC. Mortality rates 4 times higher than Ontario. In Ontario, for example, infection rates in long-term care 4 times, a little bit more higher than Ontario. And it concluded that British Columbia was faster with actions to address public health support, staffing, and infection prevention and control. And it said that leaders in British Columbia were more decisive, coordinated, and consistent in their overall response. Everyone on this call and many, many other people in BC, including Dr. Henry and many others, deserve credit for this. It's a joint success and one that we have to continue. But I am, as always, grateful to all of you for being part of this Team BC approach. It's one thing saying it, it's another thing doing it. And that includes my colleague, Norm Letnick, who has been part of this with me every step of the way. I think we did some things before the pandemic that were important too, because I passionately believe, as you know, in public health care. And the steps that we took, raising care standards in BC, eliminating the first available bed policy, training more care aides in particular and other medical and healthcare staff, and significantly, I think, supporting the sector in a way that was not divisive, but had a Team BC approach to begin with, was part of that. And our plans for the future, our plans that we've laid out in our platform and to deal with the next phase of COVID-19 are well known. And I hope to have an opportunity to speak to those throughout the debate. But thank you for organizing it. And I look forward to our discussion.
Thank you very much, Adrian. Annemieke Holthous, please, your time for 2 minutes.
Thank you very much. I'd like to thank Terry, Ganas, and Mike, and Adrian and Norm as well for this discussion. My name is Annemieke Holthous. I'm the BC Green candidate for Victoria-Swan Lake, and I'd like to acknowledge that I live and work on the traditional territories of the Lekwungen-speaking people. As was mentioned, my background is in the area of human rights and criminal law reform. But for today's discussion, I'm a mother of 4, a daughter, and a senior of the future. I'm running for the BC Greens because I believe that we need more voices in the BC legislature that support the core principles of the BC Green Party, including social justice, respect for diversity, and a real commitment to the climate. I also want to thank Adrian and Norm and the parties who've been working collaboratively together to address the COVID crisis. I think BC has been an example for the country in terms of how there has been collaboration. And that's part of the reason that I wanted to run for the BC Greens, is that I really value collaboration. Today, BC is facing not only the COVID-19 pandemic, but an opioid crisis, an affordability crisis, and a climate crisis. And while, as we've mentioned, a crisis can often bring out the best in people, it can also expose cracks in our society that have been papered over during normal times. I think it's fair to say that seniors have borne the brunt of the COVID crisis. As BC Greens, we believe that we need to provide better quality care for seniors, shift from a public or from a private system to a mix of public, not-for-profit, community-based services and co-ops. And we need to enhance the accountability for the provision of senior services. We need to recognize caregivers as the professionals they are, with the salaries they deserve. And the BC Greens are working towards a just and sustainable future for all British Columbians, including the seniors who built the province. So I thank you, and I look forward to discussing these issues further.
Thank you very much, Annemieke. Norm Letnick, your 2 minutes on the floor. Thanks.
Thank you, Mike, and thank you, Annemieke, and thank you, Adrian, for coming on this, I would say more of a forum than a debate. We have been getting along really well over the last 3 years, and I'm sure we'll do that again over the next hour. We might have different perspectives on different things, but that's healthy, I believe, in our democracy. I'd also like to acknowledge that I live and work in the traditional areas of the Westbank First Nations and the Okanagan Indian Band. Very good friends of mine, and thank them for allowing me to be here with my family. I'd also like to thank everyone out there, whether they're listening or watching the recorded version of this, that the work that they've been doing over this pandemic has been exemplary. The extra hours that they've been putting in, the overtime, that a lot of people have been putting in, the stress, the compassion that everyone's been showing for each other, and of course for the residents in their care has been outstanding. Adrian and I have had, of course, many conversations over the last several months about what's happening in long-term care, and it breaks our heart every time that we hear someone has passed away, not only for the individual and the families, but also for the staff that are suffering through the pandemic in those situations, and the stress that must cause in the facilities. I know a little bit because my mom was in one in White Rock, and my dad was in one in Surrey, and they both passed away prior to the pandemic. But it is an area of compassion, and I can just imagine what it's been over COVID. I'd just like to end by saying in this introduction that, you know, my vision, and I believe all our visions for seniors care is to break down the silos as much as possible. not only for seniors, but also for other people who are in those residential facilities, like people with MS or other disabilities that shares places, homes with our seniors. The more we can break down the silos, as Adrian and Sonia and I have shown over the last few months, and all of you, I think the better outcomes and better life we'll have for all our seniors and those that are living with them. Thank you, Mike.
Thanks very much, Norm. All right, so we're going to go to our questions. I have questions in a number of categories, and the first category today is on pandemic response, and I'm going to go to Annemieke Holthous. So Annemieke, while BC fared better than other provinces during the COVID crisis, securing adequate personal protective equipment was a weeks-long worry for many care home operators. Going forward, what measures will the government led by your party take to ensure that adequate supplies of PPE are available for not only public, but private providers of home health services, assisted and independent living, and long-term care?
Well, Mike, thank you for the question. I think we have to acknowledge that during the COVID crisis, the difficulties around getting PPE were real and were also obviously of great concern to providers, to families, and to the seniors themselves. A government that would be led by the BC Greens would clearly be working together with all partners to try to achieve adequate supplies of PPE and to make sure that we are looking at the system as a whole to address all of the COVID issues that we are faced with. But PPE is clearly an immediate need that needs to be addressed. As I mentioned, the BC Greens are looking to shift from a private system towards a more mix of nonprofit, public, and other cooperative means of providing healthcare. And so in that, as part of that, we would obviously be looking at questions of supply, not only of PPE, but other inventory and materials that need to be supplied to address the healthcare treatments and the needs of seniors during the COVID crisis.
Thanks very much, Annemieke. Over to you, Norm Letnick. So the question is about what BC Liberal-led government would, what measures they would take to provide PPE for the various operators in the continuum of care.
Thank you, Mike. Based on our experience over the last 8 months or so, working on the pandemic response with Adrian and Sonia, it is, I believe, time to formalize that kind of relationship and not just leave it up to individual personalities. So within the first 60 days of taking office, if we form government, we'll establish an emergency pandemic response committee to work with all parties and Bonnie Henry, the provincial health officer, on a collaborative approach to managing the current and future pandemics. So we'll formalize this relationship. Clearly, addressing adequate PPE will be a focus of that work. And just as a plug, if I may, in my riding, there's a new company called Breathe that is producing masks. And 6 months ago, they were not. This is a private enterprise that has seen an opportunity to help British Columbians with PPE, and they're doing it right here in British Columbia. So I think a big focus needs to be also for this group as to what can we do to encourage more British Columbian entrepreneurs to get into the production of PPE that is acceptable to government standards right here in BC, creating the jobs, of course, but also making sure that we have supply lines that are quick and sustainable. Thank you.
Thanks very much. Over to you, Adrian Dix. And again, the question is focusing on making sure that PPE is there when it's needed for not only for public, but also private providers of home health services and housing.
I think it's first of all by doing it. This was an extraordinary challenge for our healthcare system. As you know, what happened in March and April was we saw the pandemic, but we also saw a catastrophic collapse, really, of the supply chain around PPE from the United States, which caused significant consequences for all of the people on this call or on this, watching this debate, and for the BC health system as a whole. So what we've proceeded to do, and this is extraordinary work, I think, by people, the Provincial Health Services Authority, by people in the Ministry of Health, is an aggressive procurement campaign that has gone on, which is significant. Just last week, for example, 178,095 masks, 4 million surgical or procedure masks, 10 million pairs of gloves just last week. And we're going to have to continue to do this throughout the pandemic. And the other important thing is something that we worked with the BC care providers with denominational health with, which I think we did before Ontario and saved lives in BC. And everyone involved deserves credit for this, including care homes in the PPE supply chain. And I think this is particularly important in a pandemic, that a lot of the distinctions that get made have to go away. The distinctions between those care homes that don't have any public beds are a small number. In fact, we have a very robust public system of 30,000 beds, but we also have some private beds, and we have to exclude that because really the danger was in place for us, for residents everywhere, be they seniors or, as Norm has said, others. So we have to start with that. We have to build our domestic capacity, and I think we're working with the federal government on that. Norm talked about someone in Kelowna. I talked to someone just this past week in Salmon Arm. We have to build our domestic capacity so we're not facing the kind of thing that we saw again, that we have some reservoir domestic capacity to make PPE. This will also create jobs. So I think our Team BC approach has been well suited to dealing with what was a PPE crisis, a dramatic increase in utilization, a collapse in supply chains. And British Columbia, through the efforts of public servants, principally, has done an extraordinary job of finding the supplies of PPE we need, but we're gonna have to keep doing it week after week after week, and then prepare our system to be better prepared for the future by establishing more domestic supply.
Thanks very much, Adrian. So, we do have questions in a number of different categories, and including we'll be talking later on about health, human resources, and growing the labor force. So, a second part of the pandemic response. So, both the BC Liberal and BC NDP governments have provided millions for a program now dubbed Equip Care BC, that provides infrastructure improvements such as mattresses and bed lifts, as well as infection prevention and control products to long-term care and assisted living operators to protect residents and staff. A portion of these funds go to privately funded care homes as well. Would a government led by your party commit to continuing this program that supports both government and privately funded efforts to prevent COVID-19 from spreading? And so with that, we'll go to Norm, please.
Thank you, Mike. And we have a lot of questions to cover and very little time. So I'm just going to give a quick answer. The answer is yes, and move on to the next question.
Okay, then we'll go to Adrian if you'd like to talk to that question.
I'm going to be in between the 2 minutes and Norm's answer there. I think the answer is clearly yes. And Mike, as you know, as people on the call know, we provided $10 million to this program on March 31st, 2020, and really changed the basis of the program, which had been successful up to that point, but required flexibility to allow care homes to invest in infection control and also in measures that would help people get through a pandemic that has left many seniors in long-term care, and we're going to talk about this later, isolated. So yes, I support the program that we put in place on March 31st, and we're going to continue to do it because it's a good idea and because it allows some agency in community for residents and providers and staff to assess what they need in their care home to deal with infection control and to make life better, and then to make decisions about what they should spend.
Thanks very much, Adrian. Annemieke, your response to the question about continuing this program that provides infection control and other equipment to government and privately funded efforts to prevent COVID-19.
I would say that the BC Greens support the aims of the program. We definitely approve of the objectives of providing these measures of infection control and the required inventory and structure for assisting homes. We also have worked to make this a question of importance for not only our funding, but for support. The larger whole will be looking at how do we move forward in terms of best practices, and is this something that we're going to continue past a pandemic? But obviously during the pandemic and to respond to it, we will need to work with both public and private providers to address these kinds of COVID challenges. So yes.
Thanks very much, Annemieke. Okay, so we're going to move on to another category. It's families and visitation. So families have been increasingly raising their voices across the province over concerns that care home residents are suffering from the lack of human connection resulting from restrictions on visitation, notwithstanding the best efforts of care staff. So the question is two parts. Does your party support the principle that many family members should be classified as essential visitors that form a part of the care team? And in addition, what measures will your government take during the pandemic to support safe, enhanced access for family caregivers within our care homes? And I think the question begins with Adrian, I believe.
Well, there's nothing more important, I think, than the participation of family members in care home life. And one of the things that I think about often is how to make life better in care homes. So we don't have situations that are just about safety, but allow people to live better, not just longer, in long-term care. Sometimes people are in long-term care for a variety of reasons, but usually because in some sense their bodies have failed them, but that doesn't mean they shouldn't have agency and opportunity to pursue the freedom that they can pursue within that. That's the whole intention, the whole idea of it. So the decision to cancel visits, I'd say, was amongst the hardest that I have ever been involved with in March, except for essential visitors. And as you know, there are categories of essential visitors, both in acute and in long-term care. And why on June 30th, when we announced that we would be starting visits again in long-term care with Dr. Henry, we also said that we were going to provide resources to care homes to allow that to happen across the system, so that we could ensure that infection control procedures were in effect. And this is for a very obvious reason. In general, and I have visited, I would say, dozens, if not hundreds of care homes in BC in my time as an MLA, that generally speaking, visitation doesn't require staff time, but during a pandemic, it surely does. And we've seen this, and we're seeing this now as it operates every day. And so part of the reason that we are hiring 7,000 workers in long-term care across our publicly funded system is to ensure and to expand visitation, because the pandemic isn't going away. It's going to be with us for at least another year, and the current conditions of very limited visits have to be expanded. So we believe in it, we're providing the resources to do it, and we're working methodically. I want to just say this finally, and just say this as part of a note of thanks. Since June 30th, since we relaunched visits in long-term care, there have not been cases of transmission linked to visits in our long-term care system. And this is an achievement. COVID-19 is almost designed to hurt people in long-term care. And the people who have been involved in organizing those visits today and will be in future deserve our gratitude and enormous credit for making what we decided at a provincial level work in care homes across BC.
Before I move on to Annemieke, to the question about and you did, I think, answer and characterize well what's been happening in care homes. Do, in your view, family members represent part of the care team experience?
I think they do. I think I answered specifically. There is a categorization of essential visitors, but we have to be quite practical, I think. And we have to go step by step as we expand visitation again. So there are cases of essential visits and specific conditions, both in acute care, and this is very important for people with disabilities, Mike, in acute care and in long-term care, to get access to certain visits that they weren't at the beginning of the pandemic. We made changes in May to see that happen. So there is a category of essential visitors. But we have to recognize 30,000 people in our publicly funded long-term care system, 30,000 residents. And so when you're expanding visits beyond 1 and then to 2 and 3, that's a significant increase in the flow of people into care homes. And that creates vulnerability, not just for the people who are being visited, but for everyone around. So we have to do this methodically and prudently and thoughtfully. I passionately believe in visits. It's my family too. Right now, we're affected by this as well. So I passionately believe in it. I passionately believe that people have to live well in long-term care. But we have to, this is a pandemic, and it's given us some very difficult choices. So we have to work methodically, step by step. And it's why I believe we have to provide resources to everyone in long-term care, to ensure that people were kept safe and that we could expand visits.
Thanks very much, Adrian. It's a good thing that Norm answered with a one-word answer. Gives us a little bit more flexibility.
Hey, follow-up questions, Mike. Follow-up questions. That's time.
Annemieke, please, your thoughts on the role of families as caregivers and measures going forward to improve access for families within care homes during the pandemic.
Well, I think we have to recognize that social connection and is such an important element of well-being and the health of anyone, but particularly seniors in care homes. I think, as Adrian said, it's a difficult decisions had to be made in terms of restrictions on visitors. They're difficult for families. They're difficult for the seniors themselves. As Greens, we believe in evidence-based decisions, and we would be obviously guided by the advice of Dr. Henry and her colleagues. I note that there are various levels of review for families, so there are avenues to have discussions about what is an essential visit. And also, we strongly support the seniors advocate who has launched a survey on the whole question of visitor restrictions in long-term care homes. She's looking at what's happened at the past 7 months, and we look forward to the recommendations. And obviously, we'd be looking at those strongly in terms of moving forward for restrictions and what other kinds of decisions need to be made on essential visitors.
Thanks very much, Annemieke. Norm Letnick, your thoughts on the family visitations question?
Thank you, Mike. And just to continue this story with Annemieke and Adrian's comments, we of course, over the last few months, Adrian and I frequently discussed this in our regular calls. It was always agonizing to hear the stories from people, both about their loved ones in long-term care and how they're feeling isolated, and of course, from them being separated from their loved ones. So we do support the principle of enabling family members to safely visit seniors living in long-term care. And as Annemieke says, we have to continue to follow the guidelines and advice from Dr. Henry and her team at the BC Centre for Disease Control. So we want to make sure that people who have been completely cut off from loved ones and friends for months know that there's hope. And I think Adrian has clearly articulated that there is hope. We're moving in a measured manner to make sure that not only are the residents of long-term care facilities safe as we expand visitation opportunities, but also staff. And I would say that specifically in our platform, we've committed to that. We've committed to implement measures to enable family members to visit seniors living in long-term care, assisted and independent living residents during the pandemic. And I would say that one of the big things that we can do as a community in BC is to continue the great work that the 5 million of us have been doing in keeping the pandemic away from the community, low in British Columbia. And the more we can do that, the easier it will be to see more visitation in our long-term care facilities.
Thanks very much, Norm, and thanks very much to all your responses. I'll acknowledge that this has been perhaps the most vexing issue that our members and our organization has faced, and we are all working to try and see if we can find better access for families in our care homes. So I'm going to move on to a third category of in our conversation. We're going to talk about private and nonprofit care, and just to try and set a bit of context for how our system works It's estimated that the ballpark cost of building a single long-term care bed is $300,000, and it can take up to 5 to 7 years to have that new bed operational. Recent statements by both the BC Green Party and BC NDP indicate their desire to end seniors' care delivery by non-government and private operators. So the question is, in your view, should a multi-billion-dollar investment be made to replace care beds currently operated by private, for-profit, and non-profit operators to replace them by government-owned and operated beds? And if so, can you describe how the public would benefit from this expenditure? And I'll start with Annemieke.
I will thank you for the question. There have been obviously discussions about the BC Green platform and the NDP platform in terms of the mix of providers. It's not quite fair to say that the BC Greens are moving away from nonprofit companies. We've said that what we need is a mix of nonprofit, co-ops, other types of companies that are providing the care. And the real focus should be on the level of care rather than who is providing. Yet it's clear that we have had difficulties in the province with certain private providers, and what we think is the aim should be to provide excellent care for our seniors, care that allows them to be connected to their families and their communities, and to ensure that there's public accountability for the public funds that go into our system. So we are advocating an increased public accountability for different annual inspections, requiring standard financial statements, audited expense reports for private facilities. And then over the longer term, looking to a different mix of care providers, away from the private providers towards a mix of public, nonprofit, co-op. So that's the direction that we're headed. But the aim in all of this is to ensure that there's adequate and I would say even excellent care for seniors that's being provided in the province of BC.
So Annemieke, just a quick follow-up, again, to the point that this is a very costly decision that could be made. I just put that out there using the numbers that I discussed earlier on. How do you see that where the public benefit will be for those potentially billions of dollars of expenditures?
Well, first of all, I don't think that this is something that's going to happen overnight. We are not talking about shifting immediately to a different system, but I do think we have to look at the mix of systems that we have and how we are going forward in terms of that mix, and to ensure that what private companies exist today are meeting the accountability standards that we need for our company, for our seniors.
Thanks very much, Annemieke. So Norm Letnick, the question to you, should a multi-billion-dollar investment be made to replace care beds currently operated by private, for-profit, and nonprofit operators and replace them with government-owned and operated beds? And what would it be? If so, what would the benefit of that be?
Well, I won't have to answer question 2 because the answer to question 1 is no. I don't believe we should follow that particular path. I think part of the challenge that we're seeing is in Eastern Canada with the difficulties they've been having with the older style facilities and COVID-19. There's been a brush painted across the country and it's impacted BC. I would say that most of the people in our private facilities get great care given by very compassionate people. My hat, of course, goes off to Adrian and making sure that we follow through on what Terry Lake put into place prior to him leaving government, and that is to make sure we have the right amount of care hours in all our facilities. So I think that's part of the challenge is everybody in Canada is looking at this whole issue, and I would say in BC we need to address questions regarding seniors living from a holistic approach. We have one seniors population, not some seniors who live in funded residence versus private or long-term versus assisted or independent versus union or non-union. We have one seniors population, and they share needs that are equally important, and no matter where they are. In March of 2016, we had just under 32,000 publicly subsidized residential care beds, family care home beds, assisted living and group home beds. And this was an increase of over 6,500 beds from 2001. So I don't know how many beds we've increased since the last election, but I'm sure Adrian could talk about that. So going forward, our plan is to invest $30.9 billion, Mike, over the next 3 years in hospitals, primary care clinics, seniors care homes, and other things. And the goal, of course, is to replace and upgrade aging facilities to make sure that anyone who wants a private room can have one.
Thanks very much, Norm. Adrian, your response. I know that your leader, John Horgan, made a couple of statements this week. One at the debate on Tuesday night, saying that there was a role for private for-profit operators, and the next day he seemed to walk that back a little bit. So perhaps you can just let us know what your party's position is on this.
I think there's quite a bit of misunderstanding about what the system is now. There's not a public system and a private system for long-term care. There are 30,000 roughly publicly funded long-term care beds in BC, and a further 6,000 or so assisted living beds, 6,500 assisted living beds in the province. They're all publicly funded. You are essentially go there and are assessed there by health authorities to go to those facilities. And what I want in a publicly funded healthcare system is for it to act like a public healthcare system. And those are the actions we've taken. I spoke to the BC Care Providers Collaborative in January 2018 and said that we've taken a number of measures in order to make this happen. And here are the measures we took. I believe that when a senior is being assigned to a care home, that the care home shouldn't be at 2.8 hours per resident day of care in one and 3.4 in another, that we need to narrow that. And what action did we take? $240 million over 3 years. Most of that went not to private care homes or to nonprofit care homes, but to the care for the residents in those care homes. That's what a public system does. And we raised the standard of care such that at the end of this year, we're going to meet our target of 3.36, which the provincial government said was the minimum standard for long-term care. We did that in 3 years by applying resources and working with everyone. That's what a public system does. We got rid, of course, of the first available bed policy because we gave people options. Because I think in a public system that residents who have to choose a long-term care asylum and their families need some choice, and we did that. And I'm very proud of the work we did with everyone to see that happen. We got rid of Bill 29 and 94, which I think were divisive, that took away rights from workers in long-term care, and were certainly no longer consistent with our present need to recruit people. And so what are we going to do now? Well, look at our actions. We're going to invest in the 30% of beds that are health authority owned and operated, because there hasn't been investment in those for 20 years to a sufficient degree. We have 88% of seniors in single bed rooms in our long-term care system, but 12% who aren't, but most of those who aren't are in the health authority owned and operated beds. So if we're going to invest billions of dollars, that's where we should invest it first. We have to also increase the number of long-term care beds. We're doing it in Comox, where there was an RFP. We're doing it in the Interior Health Authority, 495 beds in an RFP to expand the number of beds. We have a public system. The role of the public healthcare system is to ensure that everyone has a high standard of care, to regulate the providers, be they public or be the facilities owned by a nonprofit or for-profit facility vigorously, and we have, and you've seen us take action where action was required. That's how we move forward, because in the next few years, we need more beds, we need higher standards, and we're dealing with a pandemic. And all of that requires our public healthcare system to act like a public healthcare system, and for us to do what we need to do, which is to increase the number of beds and increase resources and life to seniors.
I'm going to pause you there, Adrian. Good answer, but I know our next question is about supply of beds. So I have a chance perhaps even to talk a little bit more about that one. So the next question is around our essentially acknowledging that we have an aging population. And so the question will go to Norm Letnick first. So last January, RBC published a report titled Navigating the 2020s, stating that the twin crises facing Canada in the coming decade were climate change and our aging population. They would not have known, of course, a global pandemic was imminent. So firstly, do you accept the idea that Canada's aging population is a societal crisis on par with climate change? And then understanding that that demographic shift is underway today, what measures will the government led by your party take to not only replace these outdated care homes that we've been talking about with new infrastructure, but begin building the estimated 30,000 new beds that are going to be required in British Columbia over the next 15 years?
Well, thank you, Mike. And, you know, I understand being a student of health economics that we are getting older. We have an aging demographic. But I would say Canada's aging population is actually a part of our richness as a country. You know, you talk about how they continue, everyone, seniors, and I'm going to be one in a couple of years, continue to contribute to our economy by working, by volunteering, by doing all kinds of things that maybe 20 years ago seniors didn't do. But the senior today is quite different. You know, I know that they really work well out in the community. They're great mentors. They're great when they continue to work in their fields. We don't have a retirement age that's compulsory anymore. So, you know, I think it's not a one size fits all. Just because we're getting older, it doesn't mean that everybody is in long-term care. You know, so the more that we can do to keep them engaged and energized and part of our society, I think it's great. You know, I volunteer as a bus driver, taking seniors from their homes on different excursions. I got my class 4 license before Adrian asks if I have my class 4, right? So, you know, and I love it. I meet all kinds of people and they're all engaged in their lives. So I think we have to see this as part of our richness. What measures will we take? Well, our plan, as I said before, is to invest $31 billion over 3 years in all kinds of facilities, including hospitals, primary care clinics, senior care homes, transportation, and other things. Our senior care tax credit that we're offering is great. It's up to $7,000 per year for up to $20,000 of housekeeping, home repairs, supportive care to help seniors age safely in their own homes as long as possible. Also in the platform, we budgeted $135 million, a new tax credit for seniors home care, and an additional $120 million, Mike, for annual spending to implement our commitments to improve care and supports for seniors. And just 3 more quick things. We want to expand programs to assist people with disabilities with home renovations, improve home care visits and supports for seniors living in their own homes. And lastly, increase the supply of fully accessible units in new multi-unit residential buildings.
Thanks very much, Norm. And I think it's broadly agreed to your points that we need to have these mix of services that are going to allow older adults to lead fuller lives in these times. And so those are good things to have. I would also say, and when we go to Adrian on this one, that I don't think there has been a sense of urgency around the aging population. It's been described as a silver tsunami. It's not an analogy we like. We call it a rising tide. The water is sloshing around at our knees right now. Eventually it'll be at our chest and over our head because of this bulge that will be happening with our aging population. So Adrian, to the question about what kind of measures do you think will your party do in order for us? I realize that there are some beds that are being right now, but we're talking thousands of beds in the next 15 years. So your thoughts on that question?
First of all, I agree with Norm's characterization of it. It's not a bad thing. When public health care began in this country, the average life expectancy was about 68. It's now 82, and our average life expectancy at 65 is significant, close to 22, which is unprecedented in human history. And it's so the description of it as a crisis is not the right description. It is, of course, something we have to deal with, but it's also for those of us who are approaching those ages, an important and exciting thing. And our job is to provide, I think, a variety of responses, not just one, not just long-term care, but a variety of responses that help people to live well and can continue to contribute, because circumstances of our elders are different now than they were a generation ago. So what do we do? Well, what have we done, first of all? One of the things that's most important to me, and I think the innovations that have happened in the last 3 years, is respite care. The number of adult day programs and respite hours has increased in 2 years by 23%. That's urgency. The number of care hours in home support has increased by some 700,000 care hours. That's urgency. The number of additional hours for community-based services, such as nurse visits and so on, has increased in 2 years by 18%. That's urgency. We are catching up a little bit to what had been, I think, inadequate investments in those areas, and we have to continue to do that across the range of senior services. And we also have to look at the way our cities and our communities are organized. So in some rural and remote communities, I think that means more assisted living and more supports to allow people to live in their communities and get the supports that they need in the Vanderhoofs and the Kitamats and others, because this is not just a debate about urban areas where there's some greater sense of choice in long-term care. So I'm optimistic that we can do it, that we understand the nature of the issue, that it's an opportunity for our society, and it's going to involve a shift in the way that we think about these things. But I'm very proud of the record. I think we've acted with urgency as a province and as a community, but we have to continue to do it. And that's why you see these extraordinary investments that are being made in this time of pandemic in seniors care, including in the community, including our partnership with the United Way, which I worked with all parties, and all parties worked on to put in place of $50 million to ensure that seniors staying at home also had access to some basic services that they needed to be able to stay and rest in place during a very difficult time. So I think this is an exciting time, and I think there's great potential ahead.
Thanks very much, Adrian. And to your comment about the community orientation of how we integrate care is something that we've done a lot of work at BC Care Providers. Our report on care hubs, for example, and the collaborative that we did on that one back in later in 2018 is work that I think we're very proud of, and I would encourage people to come to our website and bccare.ca and take a look at that. Annemieke, sort of following up on this one, the Green Party has obviously been very out front on identifying the urgency of the climate emergency. In your view, does the concerns around the needs of a growing aging population in Canada sort of have some equivalency, and what kind of measures are the BC Greens prepared to make in order to meet that challenge?
So I thank you for the question. As you note, for the BC Greens, the climate emergency and the climate crisis are sort of an overarching umbrella that we look at in terms of needing to address all of our needs. But it's difficult to separate one crisis from another. We also have an opioid crisis, which has actually taken many more people. And we have to be very careful, I think, of trying to have equivalencies between crises. But obviously, there's a seniors crisis in our province. We have to address the growing number of seniors. We need to look at the healthcare, as we'll probably get to. We need to look at the nature of staff, issues around quality of care. We also need to look at the demands for healthcare, mental health care, and our platform talks to some of the supports we need in that area. I think we need to look at this more globally. We need to look at a comprehensive approach. We're looking to expert evidence, whether it's from the seniors advocate, families, seniors themselves. And we need to plan for the future. So one of the areas that we, as sort of focus for evidence-based, is we need to collect better disaggregated demographic data to better understand all the various seniors of the future and our needs in both seniors care, but health, housing, And so we're also looking to establish a task force to balance our needs of our population and healthcare services. So whether that's acute preventative care, and that also relates to what we anticipate or what we see as the vision for the future for seniors in our province.
Thanks very much, Annemieke. So just for all the people who are tuning in right now, we are having a town hall talking about seniors issues, co-organized by BC Care Providers and Denominational Health. We have representatives of the BC NDP, BC Liberals, and BC Green Party here today. We're going to go on to, we've got about 15 minutes left. So again, a reminder to keep our remarks to about 2 minutes to these ones. So we're going to talk about staffing and the crisis, there's that word again, that we have been facing. The shortages have been acute in many parts of the country and in regions within British Columbia. So in addition to the increasing demand for services, we're sort of seeing these shortages have been, have led to increased costs for overtime. We've seen worker burnout and reduced staff retention rates. Labor shortages are also understood to have exacerbated the COVID crisis in multiple care homes during the early days of the global pandemic. So what measures will the government led by your party take to grow and train the seniors care labor force of the future? And will your government, for example, advocate for a pathway which allows internationally educated nurses to receive credential recognition needed to work in Canada's seniors care sector? And I believe the question starts with Annemieke.
Thank you. I think we have to acknowledge that the COVID crisis disproportionately impacted certain workers, particularly women, people who are Black, Indigenous, people of color. So in terms of that, the BC Greens are advocating both introducing pay equity legislation and improving accessibility in employment under a BC Accessibility Act. But we need to look at the wages, and there have been improvements clearly through the COVID crisis. We learned things about people who had to work in different facilities to make a living wage. And so the aspect of ensuring that workers get a living wage and that we establish a permanent Fair Wages Commission, which deals with consistent and predictable increases for wages, are two aspects of the BC Green platform that will relate to getting more workers. Better wages is just one part, and the other is obviously the need to look at the educational opportunities for professionalizing healthcare and caregiver positions. Looking at trying to remove educational barriers that might exist for groups that are not trained. And you mentioned foreign accredited nurses, but foreign trained physicians are also another group that we need to look at. And then there's the whole aspect of supporting families who are the families of workers. So the BC Green platform speaks to having childcare supports for working parents with children under 3. And also, more affordable housing options, and those are all aspects which deal with the wages and availability of workers in the healthcare sector.
Thank you, Annemieke. Norm, what measures will the BC Liberal government take to address the need for more growing the labor force here in BC?
Thank you, Mike. So on the question of international graduates in particular, our platform includes a commitment to expand opportunities for them, for the international graduates in health professions to work in BC. Obviously the pandemic has highlighted the need to train more health workers. The previous BC Liberal government done that. It's been continued by the previous NDP government. So we have to continue to expand our capacity there, including family doctors, nurse practitioners, care providers, other allied primary care workers as needed. I would also say that, as I said before, Terry Lake, to his credit, followed the report by the Seniors Advocate, who, by the way, Terry Lake instituted, and to increasing the average care hours across the continuum. And we all know that Adrian found the money to realize that plan. And thank you to both health ministers for doing a great job with that. And also to your organization for continuing to lobby and not giving up, the lobbying government to move forward on the job training and apprenticeship programs, which I believe will serve to reduce barriers to employment in the field, and I think will pay great dividends, making it easier for people to become employed and taking care of our seniors. And the last thing I'd like to see is, many times I go to high school graduations and I see dual credit grads leaving with a plumber's first year credit or a electrician. Obviously dual credit courses offered at high school with a focus on the health needs that we have in our system would be something I'd like to see a lot more of.
Thank you. Adrian, your answer on some of the work that needs to be done to grow the labor force, and particularly some advocacy around the IENs and some of the foreign candidates for these roles.
Well, thank you. And I think people who look at public health care today understand that the issue of health human resources, having the staff with the change in our society to meet the challenges of public health care in the next decades, is really the significant issue in many respects. And we've taken some steps over the last number of years to make that better, including, in my view, getting rid of Bills 29 and 94, which undermined the stability of the workforce consistently, but also increasing the number of training spaces. And that's critically important, I think, to the future. And making changes that we work with the BC care providers on to make changes to something else Terry Lake did that was an unintended consequence of it, that we worked together to allow people from other provinces to come here and to work more easily, because there had significant impediments have been placed in the way. Sorry, Terry, to raise that. But I think more broadly, what we are going to do now, this year, in the next year, is going to be the most significant thing that has ever been done in BC to address this question. Prior to the pandemic, BC had the lowest unemployment in the province, just under 5%. And unemployment rate is now lower than the national average, but it's 8.4%. And there are a significant number of people in sectors who are dramatically affected by the pandemic, including and especially the tourism sector, who are going to be looking for work. And we in the health system, particularly in long-term care, have the opportunity to provide that work and to provide that training. Right now, we need it for our healthcare system, and those are opportunities for those workers. And that's why we put in place a plan to hire, and it's an ambitious plan, to hire 7,000 workers in the time of pandemic to support visits in long-term care, to support infection control, and to allow us to meet all of our goals in terms of staffing into the future. And that plan, which, and I'm happy to report that we've had in our initial requests for interest, thousands of people, close to 7,000 people have responded to that, who want to work in healthcare. And we have to find ways to enable them to do that, working with unions such as the HEU, working with the care providers, working with denominational health, working across the system to take this moment and to develop the care workers for the next generation in jobs that are sustainable and family supporting. That's my vision for long-term care. This is a moment for all of us, and we cannot allow this moment to pass by to address the needs of the pandemic, yes, but to address the needs of this sector for a generation to come, and we are going to do it.
Thank you very much, Adrian. So we're getting down to the wire in terms of time. So I'm going to ask you for the next couple of questions that I want to make sure at least I get to maybe give me a 60-second response. Sorry, but I know that you can be more concise on some of these ones. Just really quickly, a follow-up on the staffing issue. Some of the leadership of care homes and the administrative staff have been not as acknowledged as much as the fine work that's been done by frontline staff, care aides, LPNs, housekeeping, and food services. But we also have management who have served excessively long hours during the COVID crisis, some of it unpaid. What kind of incentives do you think government can provide to help us build that next generation of leaders in the care home. And again, if you can give me a relatively short response to that, and then we'll move on to our next question on home health and independent living. And I'll start with Norm Letnick, please.
Thank you, Mike. I haven't seen anything in our platform that would meet proposed incentives for management or administration. So obviously, should we form government as an MLA, I'd be happy to hear your ideas and how we would actually do that, how we could do that. But just to say that, I think we all recognize the need for more resources in our care homes. And we'll improve access to medical care by encouraging practice networks and innovative practice models. But again, it's obviously something that we should attack together, and I look forward to a discussion on that.
Thank you very much. Adrian, to that question regarding leadership in care homes. And I think you in the past had talked about some of the age levels, the average age of some of the people working in our care homes is a little higher.
And I think you see that reflected in our population of care aides in particular, but across the sector really, and our leaders. One of the privileges I have as Minister of Health is to meet people who lead care homes in my visits around the province, to talk to them and people involved. The chair of your board, Ali Devji, it's kind of a family thing for him, I think, but also has devoted his entire life to this sector, and we have to find ways to value that. I agree with that. And we are looking at how we fund as we go forward care homes, in part response to the Seniors Advocate report, but also to have that discussion with care home providers in the coming months. And that process is underway, led by the outstanding Deputy Minister of Health, Steve Brown, and the Assistant Deputy Minister, Terry Collins. And so this is one of the issues, I think, for that table, and I look forward to having those discussions after the election, either as an MLA or as something else.
Thanks very much. Annemieke, your quick thoughts on the kinds of things a BC Green government would help to incentivize the growing of leadership teams within care homes?
Well, first is just to say that this has obviously been one aspect of the COVID crisis. A number of people within the sector have put in enormous amounts of time, and managers are obviously one of them. I think I would echo some of the comments of both Terry and Adrian in terms of how to support them. We need to look at best practices of other countries. We need to look at what would incentives actually look like and what would their objectives be. But I also think that it would be worth looking at how do we make management in these sectors of interest for younger people. How do we work with universities and colleges to see that as a viable part of a business school, to look at other types of whether it's apprenticeships or whether it's within the schools of management, to focus in, and perhaps that's a role for an association like yours, but to work together to make those as attractive options for young people who are looking for leadership in a number of different areas.
So we've got a few more minutes left. So I'm going to turn the discussion to home health and independent living, which all of our conversation about assisted living and long-term care sometimes gets lost. But I know that all parties have talked about providing opportunities for our seniors to age in place. What measures would a government led by your party, Adrian Dix, take to support seniors to provide better access to home health services?
As I noted, I think in answer to a previous question, respite care is critically important in adult day programs. It's been the single biggest increase in the number of hours in any area, partly because I believe so strongly in it, and many in the sector do as well. So 23% over 2 years, and that we intend to continue that to meet the needs of seniors in community. In terms of home care, I think we're the only party to very specifically lay out a plan in our platform to advance and expand home care, which is critically important to allow us to deal with both a growing seniors population, but also in a healthcare sense, but also to allow people to do what they want to do, which is to stay at home as long as possible. I think also supports for seniors activities in communities. We, early on in my time as Minister of Health, increased transportation services for seniors organizations around BC. We bought some buses, and the value of that program was exceptional. So we have, I think, a sophisticated plan to improve community care that's reinforced by the investments found in the NDP platform that reflect what I believe, which is that often because of the centrality of long-term care, we forget about care in the community. And the final thing is better primary care. And we've seen this both through the development of urgent primary care centers, the development of primary care networks and community health centers. The need to continue to do that so that people can get access to the care they need as they're dealing, as we are more likely to do as we grow older, with the challenges of chronic disease.
I'll pause you there, Adrian. Thanks very much. Annemieke, really quickly, and I'd like to keep time as best as possible. Just some quick thoughts on home health and the kind of measures that the Greens.
I'll try to be brief. I think the BC Greens believe that we need to have a broader discussion about how people age, how we reduce social isolation among seniors. In our platform, we have outlined a number of different steps for making our communities more resilient, more livable. As Adrian mentioned, continuing to invest in primary care networks, developing an essential drug program, looking at mental health supports, including for seniors. And then there's a number of platform planks that deal with affordability in terms of housing. So rental supplements for people to be able to stay in place, accelerating investments for different types of housing, whether that's co-housing or cooperatives. So there's a number of measures that the BC platform contemplates for allowing people to age in place.
Very good. Thanks very much. Norm, some quick thoughts on home health.
It's to support seniors to age in place, of course, in addition to continuing respite, adult daycare, improving primary care, as my two colleagues have mentioned in the platform of the BC Liberals, we talk about seniors home care tax credit. This is up to a $7,000 a year tax credit for up to $20,000 of housekeeping, home repairs, and supportive care to help seniors age safely in their own homes for as long as possible. So that will go a long way to help seniors stay in their homes. We also budgeted in the platform $135 million in a new tax credit for seniors home care and an additional $120 million spending to implement our commitments to improve care and supports for seniors. We plan to expand programs to assist people with disabilities with home renovations. We're also going to improve home care visits and supports for seniors living in their own homes. And lastly, quickly, Mike, we're going to increase the supply of fully accessible units in new multi-unit residential buildings.
Thanks very much, Norm. I have a few more questions, but I'm going to end off with one. And it's with regards, and it could be a very short answer. None of the parties that I'm aware of have a position around independent living, which is essentially private housing, but we do see it as an expanding opportunity. It allows older adults to downsize. It provides more social connections. We know that isolation has been a big concern. Very short, maybe a 10-word answer. Would a government by your party consider either tax incentives or other fiscal measures for seniors to look at making the switch into independent living? And I think I'll start with Adrian first, please.
Sure. As you know, there are significant investments being made in what we'd call broadly seniors housing now with the support of BC Housing. I think this is an important area to proceed on, and I'm happy to consider all options. But our focus has been on improving opportunities through BC Housing, and some of the projects that are being developed are very exciting across the province.
Annemieke?
The BC Greens have two areas that might relate in that we wanted to support existing co-op housing and also have a capital fund to support the acquisition of affordable rental housing by nonprofits. So this could relate to seniors who choose to live in co-ops or co-housing or rental. So those are a number of things that might respond to this concern.
Thanks very much. Norm?
Thanks, Mike. This is an interesting concept. I hadn't thought of it before You know, a lot of questions come to mind, like would it be for people going from rental to independent living? Would it be for people downsizing their homes with very high equity in their homes to, right? Who you're going to try to help? So I would just say, you know, open mind. Let's down talk. Let's see who are the people that really need help, and then we can consider that.
Thanks to you all. I do know that this topic, the subject of housing and care for Canada's older adults, if it doesn't make the McLean Story of the Year, it's going to be a runner-up. It's been a very important and very difficult year for our operators. I want to thank all of them, and I want to thank all of you for not only stepping up and to serve the public in this way, but it is I think, a really ongoing subject that I know that we're all very invested in. Prime Minister this week has made some comments. It'll be very interesting to see whoever forms government after October 24th will be faced with the option of trying to work with the federal government. Our organization has been directly advocating the federal government through the Canadian Association of Long-Term Care to make new investments in long-term care. So hopefully some accord can be sought in that way. I would like to just again thank all of our panelists today. Norm Letnick, BC Liberal candidate for Kelowna-Lake Country; Adrian Dix, BC NDP candidate for Vancouver-Kingsway; Annemieke Holthous, BC Green candidate for Victoria-Swan Lake. I'd like to thank our sponsors, our title sponsor, Rexall Health Solutions, our gold sponsor, Point Click Care, our silver sponsors, Sobeys National Pharmacy Group and Medical Pharmacies Group. And thank you as well to the Denominational Health Association and their board for co-hosting today's event. Be sure to vote. Election day is October 24th. Polling locations and advanced voting days are all listed on BC Elections BC's website. Thank you very much, and have a wonderful weekend.
Thank you.
Thank you, everyone.
Thank you.